My name is Adam Johnson. I'm a medical doctor. I trained at the University of Utah Medical Center, and for about the 18 years, I practiced in the emergency department where was a board certified emergency physician prior to transitioning to full-time practice of endobiogeny.
How has endobogeny changed your perspective on medicine and patient care?
Endobiogeny has changed my perspective on medicine and patient care because it gives me a better idea on how to analyze how a person is adapting to life. Getting static information, lab tests is helpful and it's an important place to start. But what's a lot more interesting to me is the nature of how things are moving. And in a complex environment, whether it's studying weather or economics, I want to know the nature of how things are moving and shifting in order to make better decisions. And that's what endobiogeny brings to the table is a format for understanding how people are moving and adapting and shifting in their complex physiology.
Tell us about your journey to becoming an endobiologist, of practicing endobogeny as the sole basis of your approach to medicine.
My journey to endobiogeny partly began when I was perplexed by how many patients I encountered, often in the emergency department, who were not well. They were sick enough to even show up into the emergency department, and yet many times they had been seen repeatedly at very reputable medical centers throughout the country, always being told that they couldn't find anything wrong with them, and yet they were not feeling well. And at first glance, even looking at their diagnostic studies, it didn't look like there was any smoking gun or any clear direction for what was out of balance. That frustration with not being able to have answers for those types of situations spurred me on to look into other ways to help patients and to determine what is going on. And so I looked into various other types of methods for analyzing patients' health and data. And ultimately, I learned about endobiogeny and became so intrigued with what I was reading, at least on the theoretical level, that I knew that this was something that had some teeth to it, something that would direct my decision making. And the further I went into it, the more beautiful it became. Even early on, find and while still in the emergency department, was able to apply principles of endobiogeny to where patients had become depleted and why they were not feeling well despite having, at least on surface level, normal biomarkers.
What did it take for you to make uh, the risky choice to leave emergency medicine and practice endobogeny full time in an outpatient setting?
I wasn't running from emergency medicine. I was running towards something that I found so beautiful that I couldn't not pursue it. The further I got into endobiogeny, the more it started trickling into my practice of emergency medicine. And the further I and the more that happened, the more I realized that I needed to make this the focus of my clinical practice. Uh, Endobiogeny was so deep and complex with such a vast toolbox at its disposal that I knew that I wasn't going to be satisfied until I felt that I had some level of mastery, and that mastery wasn't going to come from simply dabbling on the side. I needed to make it the focus of my practice.
And looking back on your journey to and through endobogeny, what are some of the most surprising or exciting discoveries and realizations that you made?
All therapeutics are fair game as long as they are approached in a very thoughtful manner. And the biology of functions really helps to guide and focus that decision-making process. And so using prescription medicines, non-prescription pharmaceuticals, herbal medicines, lifestyle recommendations. All of those things just added vastly to my list of possible therapeutics for getting people restored and improving their capacity, improving their wellness. And that was extremely exciting to me to see people's health as so complex. We can't simply reduce it to one simple intervention, a pharmaceutical, but we can see where multiple areas have become depleted in a person's physiology and make a thoughtful approach to addressing all of it simultaneously. And to me, being able to appreciate the complexity and not be overwhelmed by the complexity and still have a path forward through that complexity. That's what endobiogeny really offered, was a way to sift through the myriad of possible good things for a patient and really consolidate it into a thoughtful, reasonable uh, treatment strategy that resulted in patients getting a lot better.
What would you like to share with your peers about how endobiogeny reignited or fueled your passion for medicine and healing?
As I had daydreams about what it meant to be a physician before I even started medical school, I had this vision of what it meant to be a physician caring for patients, and then going through the whole medical school training, residency training, and so forth. I found that my what I dreamed about in terms of patient care and and helping my patients really was not a reality. That's not the way medicine was practiced. Uh, Patient encounters were uh, limited to 10, 15 minutes sometimes. They were really problem specific, focused, and really scratching at the surface. And it wasn't a very satisfying way to practice medicine. And really what I envisioned in my the way that I wanted to practice medicine and interact with patients really meant knowing a lot about them, having a very comprehensive way of leading them forward. It meant not just uh, getting a set of vitals and a set of labs and saying that, yeah, you look healthy. There's nothing you can do to prevent these diseases that you're worried about in your family history. That wasn't a very satisfying. Those weren't very satisfying answers. What I saw with in endobiogeny was the ability to practice medicine the way that I had dreamed of since before starting medical school, a way to address the whole patient and to be able to reconnect all the dots and to look to do it to be able to do it at a level of analysis where I'm being able to understand how everything is interrelated.
How did endobiogeny help you become the healer and physician that you always dreamt of becoming?
While I was going through my medical training, it became more and more reduced to problem specific encounters where you were just scratching at the surface of trying to address their specific problem in that particular moment. And in a sense, just putting out a fire. And without the tools or the training or the time to try to put it all together to have a deeper level of analysis in how everything is interrelated. And from an intellectual level, that was not very satisfying. From um, a patient interaction level, it wasn't very satisfying for patients either to be left without a lot of answers. To be able to say to a patient, well, I'm not sure what is giving you this abdominal pain, but you've been seen in the ER for 5 times now. We've gotten CAT scans, we've done laboratory tests, and you've seen specialists, you've had scopes. Nobody's able to give you an answer. All I can tell you today is that it's not a medical emergency. Follow up with your primary care physician. And then they follow up with their primary care physician and they get a similar answer. And then they get turfed to their gastroenterologist. And then their gastroenterologist says something very similar. That is very dissatisfying, both for a patient and also as a physician. And it wore me down. I wanted to answer. I wanted to be able to understand more. I wanted to be able to um, help more, and that's what endobiogeny was able to provide.
In becoming an endobiologist, what else did you become along the way in the service of healing for your patients?
Part of what endobiogeny has helped me to do is to see people deeply and to be able to be seen as a patient, to be able to have your doctor see you deeply is really what they want. And to be able to, and so what I've become is in some ways more of a philosopher, somebody who is able to pay more attention to the details. And it's allowed me to become a lot more compassionate in my interactions with my patients. And so I would say I'm a better human being. I'm a better physician. I'm a better husband and father because of what I've learned in endobiogeny. I think big part of that is because I'm able to see deeper.
Would you advocate that others study endobiogeny?
Absolutely. The world needs more endobiogenists. Patients want it. And I am overwhelmed by the number of patients who love this level of interaction with me, who want this for their family members, want this for their loved ones. And so absolutely, I would advocate other physicians to learn endobiogeny because it's a more satisfying way to practice medicine. You have more answers, you have more ways to help patients, and you have more satisfying interactions with your patients. And so it's a win-win. Patients are happier, you're happier as a physician, and so that's an easy answer. Absolutely. I wish that this was a part of every medical school curriculum to some level, at least to have some familiarity with this. I don't know if this is gonna it needs to be it needs to be part of the interview or not, but what I saw with in endobiogeny was the ability to practice medicine the way that I had dreamed of since before starting medical school. I wanted to answer, I wanted to be able to understand more. I wanted to be able to help more. And that's what endobiogeny was able to provide. Every once in a while, there is something truly revolutionary. You have a Copernicus, you have a Galileo, you have a Newton, you have an Einstein, and they really shake things up. And from the perspective of their peers, it can look like pseudoscience because the science as usual doesn't fit that paradigm. And it sometimes takes years or decades to realize that, wow, they were ahead of their time, and it was a very different way of viewing the world. And the way I see endobiogeny, it's at that inflection point of being very revolutionary. And to have somebody like Christian Durfor, who saw beyond his time and taking mathematics to try to get an idea for the nature of adaptation, that is truly revolutionary. And from a contemporary standpoint, it might be hard to swallow. You might have to suspend judgment, and uh, you might have to take the approach of an agnostic and say, well, I'm going to wait for more evidence. But the further you get into practicing endobiogeny, the evidence is there because patients respond, patients feel better, and their modeling data improves. And it's to me, it's really it's nothing short of genius. It's ahead of its time, And to me, this is truly an inflection point in what I would see as a revolution in the way that we analyze and care for patients, because it's really trying to get an idea is for movement and adaptation and and that is what I find truly beautiful about the endobiogenic approach.